Hey folks, it's Dr. ShawnBaker. Revolutionize your health with Revero. Struggling with type 2 diabetes, obesity, or autoimmune conditions? Revero offers a revolutionary approach to treating chronic diseases. With personal low-carb nutrition plans, remote biomarker monitoring, and 24/7 access to expert medical providers and coaches, Revero helps you address the root cause of your health concerns. Be part of the future of healthcare. Join the waitlist today at Revero.com and take the first step towards lasting wellness.
I'd say for probably 80% of my life, I couldn't remember 3 digits to save my life. That's something that, of course, steadily progressed and lifted when I started Carnivore back in 2019. That's why I love what I do, because you got people whose hair is growing back. You got people's nails that are getting thicker, the fat's melting off. It's nice to see people make meaningful progress and watch multiple markers across their health improve. And then you do get to the point where they say, you know what, my time here has been great. I've learned a lot. I know how to maintain this health, and they know how to be healthy, and then they go out the door and continue living. They were met with being told, do not do that. That will kill you. Probably 75% of the people I'm working with right now are dealing with some form of autoimmunity. The primary care physicians were almost hurt that we took them off of a medication despite their improvement in whatever area it may be, whether blood sugar or so on. Sometimes people wake up the next day and they're writing a novel in the chat because they're just saying, I didn't know I could feel this good. I didn't know it was just that one little thing.
Welcome. We got Rance Edwards with us today. He is going to share, I guess, a little bit of a success story, but also I'm very happy to announce that Rance is one of our coaches at Revero, and a fine one at that. And so I guess for those of people that have never met you before, give us a little 2-3 minute summary of your background.
Yeah. All right. So, my name is Rance Edwards. I'm a certified health coach, and born and raised Oklahoma City, Oklahoma. And I've actually had my own private coaching practice, Full Spectrum Human, for about 5 years now. I also have a wonderful wife and daughter who are on this journey with me. They're more ketovore than strict carnivore, but that's really the gist of who I am. In terms of my success story. So I was only about a year ago, but just to go back over that, I had a plethora of issues. And funny thing is I actually had to write them down, and that's a good segue into one of the biggest problems I had, which was I had severe memory issues. And I'd say for probably 80% of my life, I couldn't remember 3 digits to save my life. And that's something that, of course, steadily progressed and lifted when I started Carnivore back in 2019. So I've been doing that for coming up on 6 years now. But this whole list of issues I was dealing with, I essentially in my early to mid 20s had the body of an old person, depressed, anxious. My mother did have bipolar disorder, and so I presented with all those symptoms as well. But the list is long. The emotional stuff was a big issue. 70 pounds heavier at the time as well. But that's just scratching the surface of all the stuff that I was dealing with. And that's what inspired me to get into health coaching. I did start out as a personal trainer back in 2019. And that was my first taste of using, the mainstream beliefs to try to help people get healthier. And there came a point where I was just hurting a bunch of people with what I was taught back then that kind of led me down the path of, I don't want to keep hurting people. I want to figure something else out that can improve some lives, and the mainstream ain't it. So that's pretty much my compressed story.
Now, we met in person in Austin. Was that maybe July or something? I can't remember whenever that Hack Your Health thing was. So it was good to finally get to meet you in person there for sure. But let me ask you, you joined our Revero team, and I want to spend a little time on this. What has been your experience as far as the interaction that you have? What are some of the common things you're finding and some of the struggles that people have, and how you're able to help them with that, supposedly?
Okay, so coming into Revero, I got to say, was a very pleasant experience just as a member of the team, just getting to serve as an allied health professional here. It's something that I find myself very fortunate to be a part of, and we just have a great group of really inspiring all-stars, if you will, and it's just good to be among them. But something that I've experienced with helping coach the provider's patients is people come in, sometimes they cry on the phone, and it's just because they have been pounding the pavement, following the mainstream nutrition advice, and it's only digging them deeper into the hole that they started out in. and they just don't have support systems. But one thing that we've been able to offer them as coaches is that support system, whereas they might not have had it through family members or friends. And it's been phenomenal watching these people. Once they have that support system, they jump on very low carb ketogenic diet that's set forth, or a carnivore diet. And the things that happen, I've heard about them, but seeing them firsthand has just been absolutely mind-blowing. It's why I love what I do, because you got people whose hair is growing back. You got people's nails that are getting thicker, the fat's melting off. And on a note about that, it's not always the scale weight. That's something that I've seen very much in practice. It's not the scale weight that always determines the fat coming off. Some people stay the same weight, but their waist is just going down like crazy. Their clothes are fitting better. Their mental clarity is there. They're shedding depression, as far as I can tell, and interacting with them on an almost daily basis. And you just see all these kinds of things heal up that people have been taught for so long that you can't recover from that. But once these people drop their carbs, drop their inflammation, water weight comes off, the joints quit hurting. Just an example is, we had a person who couldn't hold a job, couldn't go to school, because their digestion was just so messed up. They were going 12 plus times a day, having a really bad time, so much that they couldn't leave their home. And now this person, after a couple months with us, they're back to college. And so much so that, which I know this is our goal, they came out and said, I don't want to renew, because now I feel real confident. I'm back to the health that I wanted to be at, and I can live my life, and I can sustain this way of living now. And as much as it's a bittersweet thing to see them go, because I get to know these people, that's one of the coolest things. These people graduate, as opposed to people like myself and friends in the past who have been stuck in some form of care where graduation wasn't in sight. But being a coach here, it's nice to see people make meaningful progress and watch multiple markers across their health improve. And then you do get to the point where they say, you know what, my time here has been great. I've learned a lot. I know how to maintain this health. They build that self-health efficacy, and they know how to be healthy, and then they go out the door and continue living.
Yeah. And that's the thing. The healthcare should not be the healthcare disease management model is, you're in it for life. You're basically constantly going to your doctor, constantly getting medications. And as you know, that often doesn't work out too well for many people. How much contact do you have with a typical client, or you have some level of discrepancy on some people need more, some people less? How does that work for you?
So the way that we handle that, I would say we are in a nice stage for the clientele, which is, some people are very hands-off, as you said, and so they don't need much more than a check-in and a little bit of help and coordination here and there every couple of days. But some people that need it, especially the people that have a support system, we get to communicate with them on a daily basis. And because of how things are set up now as well, we have the ability, the luxury to jump on a call with somebody who really needs it, because the way that we chat through text, some situations are a little bit more complex, need a little bit more teasing out and troubleshooting. And so it's real nice to jump on a call and speak with people. And up to this point, the 70 plus people that I'm working with right now, nobody seems to feel neglected in terms of, if they need a call, they get the call. We schedule it with them and talk it out and get to the bottom of things. And then we recap that kind of stuff so that they have something to reference back to going forward. But if people want to, we're able to communicate with them on a daily basis. And that's just something I've never seen in any other medical practice.
Yeah, I think that the high contact, the frequent touch points, for some people is essential. And when I look at chronic disease, whether it's diabetes, whether it's an autoimmune condition, whether it's a mental health issue or whatever it might be, I think in many ways, obviously nutrition becomes an important part of it. Lifestyle is a very big important part of it. But a lot of times you're dealing with people that struggle with maybe even addiction and things like that. And you have to be able to be there for them, because it's sometimes a rocky road. And if you don't have the support, they fall off, they go away, and they're never heard from again. It's not enough to check on people once every 3 to 6 months, as we see in traditional healthcare. It just doesn't work well for this subset of the population, which is a large subset of the population, I believe. I think most people with chronic diseases deal with some of these issues. How much fun are you having? Is this fun for you? What's it like?
Yeah, I gotta say, I'm having a blast. As much fun as I've had running my private practice, I will just say that the fun that I have here, the connections that I've built with our team, it's just a good time. I love my job. I love waking up every day knowing that I'm going to come and do this, so much so that my other stuff's on the back burner, because it's just an absolute pleasure to interact with the other coaches and the providers. And yeah, it's almost leisure in a way for me.
Yeah, I wanted to ask you about the access to having a medical provider, because there's only so much you're allowed to do by law as a coach, and there's only certain things you know how to do. There's certain medical things that get complicated, and you need somebody with a medical background, a physician or a nurse prac or something like that that can help. How hard is it, or easy is it, or what's it like to interact with our providers?
I would say incredibly easy, much more easy than I could have ever imagined coming into Revero, because it's as quick as sending a message or giving a phone call. And back to what you were saying about how health coaches have a limited scope of practice, pairing us up with the providers, the nurse pracs, and the doctors, it's very easy to coordinate. If there's a situation that is on the line of scope of practice, it's very easy to jump into a chat or give a call to these providers and just interact and say, hey, what are your thoughts on this? Does this fall within what you're okay with given your bird's eye view of the situation medically? And it's very simple. It's pretty common that I interact with all of the providers that I'm paired with over these patients on a daily basis.
Yeah, and as our practice is growing, we're rapidly expanding to different states. I think we're actively in around 7 or 8 states right now. I'm sure we'll probably double that over the next couple of months and eventually get to all 50. What are the common struggles you see a lot of people struggling with as you interact with them? Because the one nice thing about our practice, and I think you'll appreciate, is most people that join want to be here. Like as an orthopedic surgeon, people that came to see me, they didn't want to be there. They weren't happy that they broke their ankle or needed a knee replacement. They just had to be there. Now we have a different situation where most of the people that come to us are like, yes, I want to do these things. But what are some of the common issues that you commonly deal with?
I'd say the common issues I'm dealing with, people coming in, is it goes back to that whole not having a support system, which we fill that in, but people having trouble fighting cravings, fighting urges, especially because our food environment is just so jam-packed with non-food items, essentially non-nourishing things that just keep driving cravings. Folks have a lot of trouble navigating that. Now, we even have people who are coming in living some kind of low carbohydrate lifestyle, but they're still just surrounded by these options out there, these things that are very colorfully packaged and have this draw on people. And it's nice to be able to work with them on a daily basis in finding other options that can fill the gaps on these, or finding out what does this person have in their life that they can consume that will help fight these cravings. And I would say that's probably one of the bigger things. But another thing that people are dealing with is just, I would say, the mental health aspect. Even when they've been out there attempting to follow a protocol similar to ours, what they're finding is there's one little thing that might be off that's outside of the diet. Maybe it's a lifestyle thing. It comes down to maybe the timing of meals. If they're eating everything right before bed, you could be eating all the right foods, but that can negatively impact your sleep, which bleeds over into your life. Support systems, fighting cravings, just out there also not having a clearly defined, I guess, a clear definition of what they think maybe a low carb or ketogenic or carnivore diet is. That's negatively impacting folks. But when they come into our care, it's something that us as health coaches, we can educate them on. And then, of course, they have the provider support. So they don't have somebody breathing down their neck, such as some of the primary care physicians. They're a little behind. And so maybe somebody's, let's say, something that's very common is their LDL is high, but all their other markers look great. And so they want to throw them on a statin, even if this person's lost weight, even if this person is feeling better than they ever have in their life. So that's another issue that we see coming in, but it's like their stress just completely drops when they're under the care of a provider who really sees and acknowledges the progress that they've made and doesn't just lean so heavily into LDL alone. But that's pretty much what I see.
Hey folks, it's Dr. ShawnBaker. Revolutionize your health with Revero. Struggling with type 2 diabetes, obesity, or autoimmune conditions? Revero offers a revolutionary approach to treating chronic diseases. With personal low-carb nutrition plans, remote biomarker monitoring, and 24/7 access to expert medical providers and coaches, Revero helps you address the root cause of your health concerns. Be part of the future of healthcare. Join the waitlist today at Revero.com and take the first step towards lasting wellness. Let me ask you about, because we've built in a lot of technology into the system, patients uploading their data, you guys being alerted to red flags. What are the type of things that'll, like you said, some people are going to be more hands-off. Some people are going to need more frequent interventions. Sometimes you'll get a notification that will say, hey, this person's got some issues. Let's go intervene. Talk to me a little bit about that and maybe the real life experience. Because to be honest, even though I'm one of the co-founders of the company, I don't experience this day to day because I'm not on the ground doing it. I'm out here cheerleading and trying to get people excited about this stuff. But day to day, how does that work for you?
Okay, so that's something that has been extremely valuable, I think, to all parties involved, whether it be the patients themselves or the providers or myself as a health coach. Being able to watch all their metrics. Folks come in and we send them out devices for tracking, such as blood pressure devices that automatically transmit the data to us when they plug it in. They also check their blood sugar. And so these are readings that patients are prompted to take daily, and it logs it so we can watch that graph. We can watch the trends in a good direction. And something else that helps us do remotely, which I think it's pretty cool, that we'll get an alert as coaches and providers if somebody's blood pressure is way too high, or we'll get an alert if somebody's blood sugar is way too high, or either of those if it's way too low as well. So we have our protocols. So as coaches, if we catch it first, we will reach out to the providers, and following further protocol, we'll be able to call them so that we can ensure that people that are perhaps coming in that need that extra monitoring, insulin injecting diabetics. If something's going on, I can get right with the provider and they check in with the patient, and then adjustments can be made to ensure everything is safe. So very cool to have all these different metrics logged. And that's really just scratching the surface of the metrics that we get to see.
Yeah, I mean, that real world feedback can be invaluable. I mean, in some cases it can be life-saving, but it's just, you get that level of fine-tuning and precision that you just don't get with the standard medical practice, where you, like I said, you're getting a set of labs once every 3 months. Maybe you can review some data, but the intervals are so far apart that you can't react in real time. So that's got to be a tremendous benefit here. As far as your interactions with the other coach, because you obviously we've got now several of y'all working and we're growing and adding more. How much do you guys cross talk to each other just to share your experience? Because again, this is a new way to practice healthcare. We're still learning, to be honest, and we still going to be learning how to better serve our patients and how to better be more efficient and more effective. And again, there's an element of cost savings that goes just because the healthcare system is so bloated, broken with wasteful money. How do you get to interact with your coaches?
Oh, I love the team to death for starters, but they reach out to me. I reach out to them almost on a daily basis. If one of us runs into a complicated issue, or maybe something that us as an individual is not as well versed in, it's almost guaranteed that somebody else has dealt with it in their coaching experience. So we roundtable a lot. We even get together once or twice a week and just talk about how coaching's going. We brainstorm and bring up situations in which somebody might be stalled out or not making the progress that they want to be making. So it's nice to be able to get with the coaches fairly frequently and just find ways to break through these plateaus, or even get together and come up with a bunch of options for somebody. For example, if somebody's traveling and they're dealing with some chronic health conditions, it's hard to maintain some of the protocols when you're on the road. But we coordinate very frequently and just lean on each other whenever we have gaps in our individual experiences. And I think that's something very powerful and very motivating for us and for the patients to know that I might be your coach, but hey, there's a whole other team that I go and coordinate with and speak to, and that bleeds over into being able to help you better.
Yeah, absolutely with that. What do you find to be some of the more, we talked about food addictions and cravings and things like that. The typical patient that you see, do you find that their environment has been less supportive for them and you have to change that a little bit? Because obviously one of the things I found, I did a survey of about 12,000 people on a carnivore diet for, I don't know, 2 or 3 years ago, I think it was now. And one of the things we saw was unsupportive physicians, unsupportive friends and family was a impediment to success. In fact, it had a pretty big impact on that. Are you finding that many of the people that come to you, that their interactions with their traditional physicians, maybe it's their PCP, has been less than satisfactory in many ways?
Absolutely. I would say that the vast majority of people that come in that I interact with, they are not supported in any way whatsoever. Now, there is a handful of people on the side that do have the fortune of family members and providers that do support this, but the majority of them, they come in and some of the things they pass on to us is that, hey, I trusted my primary care physician and I told them, hey, I'm just letting you know I'm starting the carnivore diet. And they let me know that they were met with being told, do not do that. That will kill you. And just as blunt as that. Now, it also goes over to family members. I find that people are feeling very isolated, very alone, especially at holiday gatherings or just any kind of family gatherings, because people around the table think that this way of eating is going to lead that person to early grave. Now, I think that lack of support there, that's something that we as coaches can work with them to make up for and learn to be self-supported and point them in the right direction of where to learn so they're confident in what they're doing. But it is definitely very difficult for people, that just total lack of support system. And that's why I run into people that are just about on the verge of a breakdown because their physicians and the people that are immediately around them, people that they have trusted all their lives up to this point, and people that, frankly, I think they should be able to trust as physicians, they're scaring these people. They're just putting them in a state of fear, which is just increasing their stress even further and negatively affecting their health. So that's a lot of what I'm getting.
Do you find, so what is, I'm just patient demographic, who are you typically seeing? Are we seeing males, females, age ranges? What is our typical clientele tending to look like at this point?
Currently, the vast majority, even though there's a wide array of people from 19 all the way up to almost 90, the majority, the biggest group is probably women around 50. They seem to be the most affected by these stressors in the environment and the diet. So that's what I'm seeing.
Okay, fair enough. And you said we've got patients as young as 19 and as old as 90 in our group?
Oh yeah, all across the spectrum, and it's crazy.
How much autoimmunity are you seeing?
Oh, I don't want to just say a ton. I want to give it an actual quantifiable number, but if I had to guess, probably 75% of the people I'm working with right now are dealing with some form of autoimmunity, and and that goes all the way to the group that's closer to 19. It just seems like we're seeing it early and earlier.
Yeah, interesting. And it is becoming more and more common, and we're well positioned to help with those issues. Deprescribing medications, now obviously the physician will be the one that does that, but you probably are aware when that's happening. Are you seeing that happen?
Oh, yes, on an almost daily basis, if not daily. It's not uncommon at all, and I think it's absolutely miraculous and beautiful that we have people come in that are on 13, 14, 15, probably even more medications that I'm missing in my memory, and within a couple of weeks, I'm already getting the alerts like, whoa, their blood pressure is way down, got to get with the provider, and it's because we need to knock these medications off because their baseline blood pressure, it's going back to normal, so the medications are pushing it too low, and the same for blood sugar with people on metformin. So I got to just constantly be running to the providers to let them know, hey, like this person their markers are too low in this area, so we might want to look at those medications.
Yeah, that's really cool. That's nice to see there. You said your caseload is about 70 people at a time. Is that full time for you, or do you have a little more room that you could handle a little more? I'm just trying to figure out what we're going to be seeing coach per patient level.
So at the moment, I think with the stage that we're at as an organization, 70 is full time for me. But I do anticipate with a lot of the things that we have in the works, especially quality of life features that translate to both coaches and the patient side, we will be able to handle more within a full time capacity just because things are going to be streamlined. But at current, that is what my full time looks like.
Yeah. Okay. Fair enough. That's good to see. You've had, as you said, you had a health coaching capacity of your own that you did privately. You've done this. And we had a lot of people apply for these positions. We got, I think it was something like 3,000, if I'm not mistaken. It was some very high amount. But would you recommend this as an occupation for other people that might be considering something like this?
I absolutely would. I think this definitely is a place where, especially people that are kind of part of the mainstream medical system, if they're facing burnout, becoming a health coach and coming over to this side, this is like the cure to burnout because you get to see people progress and conditions reach resolution. A lot of stuff go into remission where it may not have in their careers. But I think even as people in our space already who are starting out as health coaches, it's a great place to be. You get a lot of experience. You really get to interact with people. I think even a lot more so than some folks in private practice. And it's a great experience to also learn from people such as our other coaches, because we've got people in here that just have such a wealth of knowledge and massive educational background. It's definitely somewhere where you can learn something new almost every day and just build upon yourself. And then what that translates to is being able to help the patients of Revero better. And so it's just this constant cascade of feeling good and really enjoying and liking what you do because you're making a noticeable difference.
Tell me a little bit about the onboarding process as a coach, because there is obviously you've got to fill in all these. There's some things you got to do, but there's some training that was involved, modules. Can you talk a little bit about that process?
Yeah, absolutely. So one thing that I was really impressed and surprised and excited to see coming in is that our onboarding program here for coaches that want to work for us, there is like you said, there's a course with multiple modules that cover different areas of health and then how to go about coaching, models of change, just how to talk to people and change behavior. And I was actually certified through the Primal Health Coaching Institute, and coming in here and looking at this was comparable. So it's a very large, very, I guess, not to make people afraid. If anything, it's great that there's so much information there that you can go back and reference. And it also helped me better understand, on top of my previous understanding, some of these chronic diseases, these inflammatory conditions, autoimmune and metabolic. So that's what the biggest chunk of onboarding was, just kind of making sure that our knowledge and our certification coming in was standardized across the coaches. But other than that, just talking with individuals that were part of the company, really learning about the company. That was a very welcome, I guess, change of pace as opposed to other places where you don't get to know the people that work in the different positions in the company. But here, I feel in onboarding a person was just a message away, whether they're an engineer or even you or the co-CEO. It was very pleasant for me.
Yeah, I love when we get new folks. I get to chat with them, and it's a lot of fun. And let me ask you, you said you have a lot of folks, very often women, middle in the 50s and so on and so forth. Many of them, correct me if I'm wrong, were struggling with issues for many years, probably been seeing physicians for perhaps even decades, not getting better. And then all of a sudden we're able to pull meds up. Is that what you're seeing, that people with many years of illness being able to finally resolve these things? Is that what you're saying?
Absolutely. And a lot of these women in this age group around 50, some of these conditions they were essentially born dealing with. So as long as that 40 or 50 years, they've been living what they thought was inevitably going to be the rest of their life. But they do come in here and we do get to pull medications, and they have been bashing their head against this wall. These poor ladies that have just been out there in the wild fighting against these physicians. A lot of them, when I interact with them, they even know their stuff. But the one thing that keeps them from implementing all that is just the gray area and fear that is facilitated by the physicians that they've been trying to work with up to this point. But absolutely, they come in and we work on getting their stress down and fixing their diet and other areas of lifestyle. And it's miraculous to them, and they're always shocked. And a lot of times, frankly, on the verge of tears, and we facilitate that safe space for them to feel out those emotions. But they're reaching a life. It's like they're starting their life over again with a better hand.
Let me ask it from the patient perspective, because there's some things we ask them to do. Like we ask them to fill out some forms so we can evaluate and assess where they're starting at, where they're going at. Some of this will go into research publications because we want to be able to publish our data so that we can show how efficacious we are, maybe how much cost savings we can do. Are you seeing anyone does it seem to be no problem to get folks to do that?
Yeah, it's very rare that we have folks that aren't plugging in data and providing goals and updating us. And I think the very few cases in which they're not is just because of factors outside of Revero, such as if somebody is traveling abroad or something like that, their schedules are just packed, and I'll check in with them and say, hey, I just wanted to make sure everything's okay. And they'll just let me know, yeah, sorry about the biomarker stuff. I'm traveling, or we even had a fellow with a tree fall through his house. But those are really the only scenarios in which people will have gaps in plugging the data. But across the board, it seems very accessible to the patients, and they're pretty on top of it because, like you said, they come in really at the point where they've heard enough that they want to change and they're going to do anything.
Yeah, I think it's clear that we mentioned we are not primary care providers. If you got a cold or you break your wrist, we're not going to be able to deal with that. And this is impossible. I can't imagine. When I was in my surgical training as an orthopedic surgery resident, we had to work with the Texas Department of Corrections, their prisoners, and it wasn't always convenient to bring prisoners in because security risk, it's a problem. So we would do a lot of remote care orthopedic wise. And you can imagine trying to do an orthopedic examination of someone's knee from 150 miles away on a video screen. It didn't work very well. It was just bad care in my view, but that's what we did. And we would screen that way. Then you bring them in if you thought something was really there, and then you could maybe refine that. But we're not replacing people's primary care physicians, but a lot of the things that primary care physicians deal with, we deal with. And so I think that's a fair way to look at that. Have you gotten feedback yet from you take care of a patient, you're able to discontinue their medications, they go back to their primary care physician and have a message and say, maybe my primary care physician said this isn't right, or are you getting much of that?
Not as much as I'd expect, to be honest. And it really does come down to my group of 70 patients, because, the other coaches may have had some different experiences. But I have periodically received some of that. Somebody will go get some testing done or get taken off a medication by one of our providers, and they go back to their primary care physician. Now, we've had a couple instances where this is just guessing based off of the scenario, but it seems like the primary care physicians were almost hurt that we took them off of a medication despite their improvement in whatever area it may be, whether blood sugar or so on. But I'm sure there's more to come as we grow.
It sounds like we're going to be removing a lot of medications from patients, which I think is, obviously a good thing, particularly if it's, because they no longer have the condition that's necessary for it. So that's gotta feel really good. Let me change here. What do you do for fun? What's on your free time? Because it sounds like your job's kind of fun, so that's cool. But what do you do? What do you do outside of this stuff?
Yeah, other than working Revero, I think, not trying to give a cop-out answer, but I just have a big passion in nutrition. So it's like when I'm not working on the clock for Revero, it's like I'm continuing nutrition education. Other than that, the normal people stuff. I do work out, and I think a year ago I'd mentioned that I was going to try to pack on some muscle. And since then, I've been hitting the gym more. I like my body weight movements. Maybe one day I'll get up to benching or deadlifting as much as you, maybe just a dream, but I do like to get my pull-ups in, get my push-ups in, my dips, all that kind of stuff, throw some weights on. And then, of course, playing with my daughter, who is she's a monster too. She's just exploding in terms of her learning speed and her physical activity. And playing with her, it used to be I'm outrunning her. Now she's catching up to me. Now she'll rep out 50 push-ups as a 9-year-old and puts the boys on her school basketball team to shame. And so I got my hands pretty full between work and research and working out and playing with my daughter.
Good for you. The kids are great. Yeah, I've got 4 of my own, and that's one of the best things I've ever did. Let me ask you, let's just transition in this topic, because obviously Our company is very much focused on nutrition. You as coaches see the lifestyle as a whole. Is there any other areas that you tend to have to tweak or adjust for people outside of just their nutrition?
Yeah, absolutely. I think there are just so many factors that we have to tease out as we get to know each of these individuals that we're working with. And somebody could have the perfectly tailored carnivore diet, for example. And if there's something that's just keeping them from making progress, it's typically stress related or sleep related or activity related, which all kind of combine, and one's not by itself. All these things bleed together. But for example, sleep has been one of the bigger things because, if you're not getting good sleep, you have all these different systems in the body that just aren't working as well as they could be. And you just become less resilient to stress, especially people with mental health conditions. We see those worsen after people have a bad night of sleep or 2 or 3 in a row. And once we correct those, working on maybe, hey, let's move your last meal away from bedtime. Maybe not pound a bunch of water right before you go to sleep, and making little tweaks in this area. Sometimes people wake up the next day and they're writing a novel in the chat because they're just saying, I didn't know I could feel this good. I didn't know it was just that one little thing. So yeah, we're definitely looking at all the different lifestyle areas that just support health on top of diet.
Yeah, I know. And this is obviously, we build out a new technology. We build out apps. We build out all electronic medical record system that we have to interact with and all these types of things. And how is that working? I see the chats between the engineers on our Slack channel. Fix this little thing, fix this little issue, which I'm told is what happens in every company that's a tech company. You're always troubleshooting and fixing little technical things. But does it generally flow pretty well for you and the patients and the physicians?
Oh, yeah. I'm shocked because I did come from working at other companies that were huge, over 300 employees, maybe not that huge, but with whole IT departments. And they were not tackling issues as fast as our engineering team does. So if there's something that's not streamlined, it's as easy in that very moment. When you catch it, you just reach out to them, give them some info. They get eyes on it and they start working on it, and stuff's typically corrected or implemented in under 24 hours. So it's wild to me, but otherwise everything seems to flow very well. Any little incidents are typically isolated and not across all the company or all the patients. We are implementing lots of things. We're moving fast. And I think there is a lot of growing pain, but it's all positive growing pain because everybody seems to look at this as a labor of love, and we're tackling the pains quick and getting through them. And then we're getting on the other side and things are pretty efficient after every update or fix.
Yeah, we just went through a big, huge political season, and one of the topics was this so-called "Make America Healthy Again" agenda, which you'd be hard to argue with that as an agenda. I think it makes sense to most people. How do you feel that Revero aligns with that sort of sentiment or agenda?
I think in a way, even if we haven't used that exact terminology, that's something that we've been doing since Revero launched. It's been a mission, and now that it's in the public eye, I think it's only going to further allow us to grow at a more exponential rate because we look at root cause. It's right on the website, root cause healing, and I think that's something that I am hopeful about and expecting to be a household understanding, just looking for the root cause as opposed to dumping meds. And so I think we very closely align with the whole concept of really making America healthy again.
Yeah, like I said, I think it is. I can tell you when I was practicing as an orthopedic surgeon, I started getting an inkling of this is the way to go. I didn't have any resources as a physician. I didn't have a Revero. I didn't have a team of coaches. I didn't have apps and teaching and technology and feedback and biometric feedback devices available to me. All I could do was say, hey, go watch this video, read this book in the 5 minutes I have with the patients. And so we've totally changed that paradigm in a way that I think makes better sense. I think it's more efficacious, and certainly it's going to be more cost effective. So I think I hope that we continue to grow, and I have no doubt that we will. I have no doubt that we're going to be wildly successful, and we're going to be taking care of not only the thousands of patients that we will soon be, but that hopefully it goes into the tens of thousands, hundreds of thousands, even millions of patients over time. And so I'm just thankful for not only our patients that join us and give us the opportunity to do this stuff, but also for guys like yourself and all of our coaches and our support staff and our engineering team and ops team and marketing team and all that stuff. It's just wonderful that everybody's aligned. And I think listening to you talk, you're clearly passionate about this stuff. You clearly can see the value in this. And it's just so exciting to be at a place where everybody's on the same page and it's about the mission. And the mission is getting people healthy. That's the only way we succeed. As I've said that many times, the only way we're successful as a company is if we can put up the numbers and put up the results, which I think we are doing already. So it's very exciting. So Rance, I don't want to, like I said, I don't want to beat a dead horse to death, but anything else that we did not discuss that you want to share about the company, yourself, or your journey or anything like that?
There is one thing I want to highlight that I think I didn't really touch on properly, and that's going back to the old ways, the current ways in a lot of ways, how doctors just don't have the time to spend with the patients. Bringing in allied health professionals such as health coaches into settings like this, we do have that, I guess, ability, that luxury in a way to just spend more time with people. And the beauty there is that hands-on time where people are open to ask questions and start to learn about and understand stuff. I think that is very necessary in essentially training these people to continue to live their best, healthiest life once they leave our care. And that's where I use the term self-health efficacy. I just love it when people get to the end of their time with us and they understand. So now they can go out there into the world and they're more equipped and understand why they're doing what they're doing and how it affects them. Maybe that's going to spread to somebody they know that's going to listen and give it a shot, either come back to us or just improve their health on their own. So I think we've got definitely a contagion effect of good health in a way.
Yeah, it'd be nice if good health were to spread like a virus. I often use the term being empowered or disempowered. And I think a lot of the traditional healthcare is very disempowering. Diagnosis, doc, why do I have this? We don't know. Bad luck. Who knows? Genetic. What do I do about it? You take these drugs the rest of your life. That's disempowering. That's depressing. And we're freeing people from that. Well, Rance, thank you so much for doing this. I really appreciate it. And I look forward to hearing about more and more successes as I know they'll come. And I appreciate what you're doing. And thanks for being part of our company. And just all the best. So thanks so much.
Thank you, Dr. Baker.